If your doctor has been unable to resolve your or your loved one's condition, please leave us a comment with a brief description. We will get back to you with current research information. Lactose intolerance. People with lactose intolerance are unable to fully digest the sugar or lactose in milk. As a result, they have diarrhea, gas, and bloating after eating or drinking dairy products. Symptoms. The signs and symptoms of lactose intolerance usually begin from 30 minutes to 2 hours after eating or drinking foods that contain lactose. Common signs and symptoms include diarrhea, nausea, and sometimes vomiting, stomach cramps, bloating, and gas. Lactose intolerance, which is also called lactose malabsorption, is usually harmless, but its symptoms can be uncomfortable. Too little of an enzyme produced in your small intestine called lactase is usually responsible for lactose intolerance. You can have low levels of lactase and still be able to digest milk products. But if your levels are too low, you become lactose intolerant, leading to symptoms after you eat or drink dairy. Most people with lactose intolerance can manage the condition without having to give up all dairy foods. Causes. Lactose intolerance occurs when your small intestine doesn't produce enough of the enzyme lactase to properly digest the milk sugar lactose. Normally, lactase turns milk sugar into two simple sugars, glucose and galactose. These are absorbed into the bloodstream through the intestinal lining. If you are lactase deficient, then the lactose in your food moves into the colon instead of being processed and absorbed earlier in the intestine. Once lactose has entered the colon, bacteria interact with undigested lactose and causes the signs and symptoms of lactose intolerance. There are 3 types of lactose intolerance. Different factors cause the lactase deficiency underlying each type. Primary lactose intolerance. People who develop primary lactose intolerance, the most common type, start life producing enough lactase. Infants who get all their nutrition from milk need lactase. As children replace milk with other foods, the amount of lactase they produce normally drops, but usually remains high enough to digest the amount of dairy in a typical adult diet. In primary lactose intolerance, lactase production falls off sharply by adulthood. This makes milk products difficult to digest. Secondary lactose intolerance. This form of lactose intolerance occurs when your small intestine decreases lactase production after an illness, injury, or surgery involving your small intestine. Diseases associated with secondary lactose intolerance include intestinal infection, celiac disease, bacterial overgrowth, and Crohn's disease. Treatment of the underlying disorder might restore lactase levels and improve signs and symptoms, though it can take time. Congenital or developmental lactose intolerance. It is possible but rare for babies to be born with lactose intolerance, caused by a lack of lactase. This disorder is passed from generation to generation in a pattern of inheritance, called autosomal recessive. This means that both the mother and the father must pass on the same gene variant for a child to be affected. Premature infants can also have lactose intolerance because of an insufficient lactase level. Risk factors. Factors that can make you or your child more prone to lactose intolerance include increasing age. Lactose intolerance usually appears in adulthood. The condition is uncommon in babies and young children. Ethnicity. Lactose intolerance is most common in people of African, Asian, Hispanic, and American Indian descent. Premature birth. Infants born prematurely might have reduced levels of lactase because the small intestine doesn't develop lactase-producing cells until late in the 3rd trimester. Diseases affecting the small intestine. Small intestine problems that can cause lactose intolerance include bacterial overgrowth, celiac disease, and Crohn's disease. And certain cancer treatments. If you've had radiation therapy for cancer in your stomach or you have intestinal complications from chemotherapy, your risk of developing lactose intolerance increases. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.